Good afternoon. Welcome to this Money and Mental Health Policy Institute webinar. We're very grateful that you've taken the time to join us this afternoon. Welcome. I'm Katie Alpin. I'm Interim Chief Executive of the Money and Mental Health Policy Institute, and I'm delighted to welcome you today to the launch of our brand new report, A Safer Bet, Online Gambling and Mental Health. Online gambling has been something we've been talking about more during the recent lockdown period, as we know people have been stuck at home, and I think quite a lot of us have been worried about the temptation that gambling might pose during that time. So we've been digging into it, working out what's really going on and what the things we should be looking at are. Money and Mental Health, if you haven't come across us before, are a research and policy charity. We research into what's really happening, particularly with people with lived experience of mental health problems, drawing on our fantastic 5,000 person strong research community. And then we look to find practical solutions that really work. For our agenda for today, we're going to have a very brief presentation of the findings and recommendations of our new report by our Senior Research Officer and report author, Merlyn Holkar. And then we'll be sharing some lived experience as well from one of those fantastic research community members, Rachel. After that, we have two brilliant speakers joining us. Anna Hemmings, who is Chief Executive of GamCare, who are a large gambling treatment and education charity, and also Shahriar Coupal, who is joining us from the Advertising Standards Agency. So, without any further ado, let's get cracking with the show. I don't need to tell you where the toilets or the exits are, on remote at least. So, for today's discussion, I can't see all your lovely faces, unfortunately, but we would really love to hear your views and particularly your questions. We're using Slido to facilitate that, and you should be able to find the link directly below my face in this video. To get you started and the conversation started, we've got a quick poll up there so you can feed in your opinion right from the beginning of this event. And the question we would like you to answer is, which of the following do you think is the biggest problem for people with mental health problems who gamble online? Is it that it's quick and easy to deposit and spend money? That people can gamble more than they can afford to lose? That online gambling is available all day and night? Or that games are often designed to nudge people to keep playing? We'd really love to hear which of those issues you think is the thing that we should be concentrating on as we look at ways to better support people online. And we'd also love to hear your questions for our brilliant researcher Merlyn and our fantastic panellists. People do have a bit of a tendency, we're finding with online events, to leave those questions till the very last minute. And if you only send them in 5 minutes before the end, it's very hard for us to ask our panellists them all. So please, if you have questions, start asking them right now and we'll get them fed through so we can have a really good, hopefully about 30 minutes of discussion once we've had our initial remarks from our panellists today. I think that's all the business that I have to do. So without any further ado, I'm delighted to hand over to the marvellous Merlyn Holkar, Senior Research Officer at Mental Health, Money and Mental Health. I've yet to find a technical regulatory challenge that Merlyn couldn't crack. So Merlyn, please do tell us more about online gambling and what we need to be thinking about.
Hi everybody, so thanks for tuning in. For this project, we're really looking at people with mental health problems' experience of online gambling. And our research has included some new nationally representative polling from Populous to try and get a sense of views and experiences from right across the country. As well as this, we ran 2 surveys and held a focus group with our research community that Katie mentioned earlier. And we think this gave us a really detailed insights into some of the problems that people currently experience and also people's views about different ways we could go about reducing harm when people are gambling online. Across our research community sample, we found quite a variety of experiences really. So on the one hand, we had people who gamble online without many problems in a way that they felt was perhaps quite affordable and quite safe, through to people who experience problems some of the time, perhaps particularly when they're unwell, all the way to people who experience quite severe and persistent problems with online gambling. And for this project, we're interested in reducing harm right across that spectrum. So we think that our recommendations will make the online gambling environment safer for all players, but particularly for those that currently experience the biggest problems. So what are the problems? What are the harms we're talking about? Well, we found that problems with online gambling can have a really devastating impact on both people's mental and financial health. From our research community, about 1 in 4 respondents have experienced financial problems as a result of gambling online. So this is things like struggling to pay bills or having to cut back on some essential spending to make ends meet. We also found that about 1 in 3 respondents have become stressed or anxious because of gambling online. We think this is quite concerning because there's a risk here that we're aggravating existing mental health problems, making them worse. So as part of this research, we wanted to explore what drives this harm for people with mental health problems, so we can think about steps to address the harm. And broadly, we found that mental health problems can affect the reasons people gamble, people's ability to stay in control of gambling, and also their ability to cut down. And at each of these points, we found that the design of the online gambling environment can exacerbate the problems, it can make them worse. So again, from our research community, we found that more than 8 in 10 respondents felt that online gambling was more addictive than offline gambling. So I looked first at reasons. So people told us that mental health problems can drive them to gamble for reasons that are particularly likely to cause problems. As this quote illustrates, mental health problems can make it harder to think clearly when people are unwell, and sometimes this can lead people to have an unrealistic view of what gambling might offer. Some people told us that when they're unwell, they came to see gambling as a potential solution to their financial problems. Others told us that mental health problems led them to see gambling as a form of escape. So particularly if they're feeling low and feeling isolated, the feeling of excitement that online gambling can provide can become quite enthralling. It can lift your mood in the short term, but in the long term, there's a risk that this can lead to dependency. So gambling for these reasons is quite likely to result in harm. And the thing about online gambling is that it's always available. So whatever time, day or night it is, however unwell you're feeling at the time, it's quite accessible. And so from our research community sample, we found that just over half of people said that they had gambled online during a period of poor mental health. And many described that they felt they were particularly vulnerable to harm when gambling at that kind of time. So secondly, control. So staying in control of online gambling can be difficult for anybody. But our research suggests that the design of online gambling sites can make it even harder for people that have mental health problems. Impulsivity is a big factor here. So increased impulsivity is a very common symptom of several different mental health problems, but also of some medications that people are prescribed for their mental health. And people told us that the speed and ease with which you can gamble online can make it very difficult to manage if you're more impulsive at that time as a result of your mental health, and that quite often this can lead to people overspending, spending more than they can afford to lose. Others told us that the design of online gambling sites can sometimes make it feel like you're not spending real money, particularly when you become absorbed in a game. Clicking a button doesn't always feel the same as handing over a banknote, for instance. And people said that this can be particularly the case when they're unwell. These two figures are both from our national polling, so they're representative of the UK population. And I think both of them are quite striking, really. So firstly, among online gamblers who've experienced mental health problems, we find that about 4 in 10 say it doesn't feel like they're spending real money when they're gambling online. As you can imagine, this can really fundamentally affect people's perception of risk, and it can sometimes lead to overspending. We also found that a really significant portion of this group, about 1 in 3, said that it is not easy to stay in control of online gambling. So this is a large segment of people who don't always feel in control and who might be at risk to harm. People also told us that mental health problems can make it harder to cut down on online gambling. So we asked our research community respondents who had tried to cut down if this was an easy thing to do in their experience. And just 6% agreed that it was easy, while about 7 in 10 respondents said that it wasn't. So strong findings there. I think in general, we know that mental health problems can make it harder for people to seek help early. So particularly for people experiencing anxiety, avoidance is quite a common coping mechanism to deal with that feeling. And when it comes to gambling, it can mean that gambling problems can become more entrenched. The behaviours can become harder to address by the time that person has looked for help. Another important factor here is advertising. So trying to change your behaviour is hard enough at the best of times, but it can seem almost impossible if you're being bombarded with adverts for online gambling. From our research community, 85% of respondents felt that it's impossible to avoid seeing online gambling adverts. And if you think about it, particularly if it's an online advert, the journey between seeing that advert and placing a bet can sometimes be incredibly small, sometimes just a few clicks. So if your health condition makes you more impulsive, this can be quite a problematic combination. It can make it harder to cut down on gambling. So as part of this project, we've also worked with members of our research community to think about different ways to make the online gambling environment safer for people with mental health problems. In the report, we've set out some practical changes that gambling companies can make right now to reduce harm. We've also looked at the role of banks and other financial service providers, of online advertising platforms, and of internet service providers like your broadband provider as well. Today, I'm just going to focus on a few of our recommendations for changes to online gambling regulation. I think in general, there's a growing recognition now that regulation hasn't quite kept up with the pace of change in the online gambling market, and that this has opened the door for harm for some people. So here are 3 changes we'd like to see to reduce harm for people with mental health problems. So firstly, currently, the onus is really on the player to take action to set a limit to protect themselves from harm. But we find that this approach really fails many people with mental health problems. So we'd like to see an introduction of safe stake limits across online gambling markets, like those that have already been introduced to fix odds betting terminals in gambling shops. We'd also like to see more responsibility placed on gambling companies to look out for signs that their customers are struggling and to offer proactive support rather than waiting for a customer to ask for help. So this happens to some degree already, but we found that it's not always very effective. We'd like to see regulation that focuses really squarely on outcomes for customers and that directly incentivizes companies to try and minimize harm. So if a gambling company offers support, but the way they're doing it is ineffective and this is resulting in harm, we'd like to see enforcement action taken against those gambling companies by the regulator. Finally, control settings. So even if safe limits are introduced, we think that additional opt-in control settings can play a really important role. For instance, the option to set yourself a tighter spending limit if that suits you a bit better. If they're designed correctly, these tools can be really empowering, but we find that awareness is still too low. These tools aren't always easy to set up, and some people in our research community felt that they're not really sticky enough to prevent harm. So it's too quick and easy to loosen these restrictions, to raise limits, even potentially during a period of poor mental health. So to address this, we'd like to see the Gambling Commission review how easy it is to locate these tools, to set them up and to loosen them, to make sure that they're as effective as possible for people who are struggling with gambling problems. There we go. So those are 3 changes to regulation that we think could reduce harm for people with mental health problems. As I said before, there's lots more detail in the full report, so please do have a look. Thank you.
Thank you, Merlyn, for that brief but really informative summary of your research. We should also at this point give a shout out to Merlyn's co-author, Chris Lees at Money and Mental Health. Thank you, Chris, for all your hard work on this as well. We're now going to hear from a member of Money and Mental Health's research community. Rachel has lived experience of mental health problems and of struggling with gambling, and has previously used both self-exclusion tools and transaction blocks to try to control her gambling. Rachel was more comfortable recording a video than speaking to us live today, so Merlyn caught up with her earlier last week. Apologies, everyone. We got ambitious with the tech there, and it appears not to have worked as well as we'd hoped. For now, let's move on and hear the results of our polling. Thank you to those of you who took part in that. What we found is that 42% of you said the biggest problem is that online gambling is available day and night. We also had 28% saying that games are often designed to nudge people to keep playing. 23% saying that people can gamble more than they can afford to lose. And 7% telling us that the biggest problem is that it's quick and easy to deposit and spend money. It sounds like all of those things might be a problem in one way or another, drawing on Merlyn's research, but interesting that that all day, all night, always available element of online gambling seems to be a thing that's causing particular concern amongst the group of people we've got listening today. while we're trying behind the scenes to fix Rachel's video so you can hear her brilliant contribution to this conversation, we'll move on to hear our opening remarks from our brilliant panellists. So to start with, we'd love to hear from Anna Hemmings. Anna Hemmings joined GamCare in January 2018 and has experience working in health and social care with a focus on addictions. She's previously worked with a range of commissioners, grant givers and external partner organisations to deliver influential and insightful third sector services. Anna, we'd love to hear your reflections on the research findings, particularly in light of the work GamCare do supporting people affected by gambling problems.
Thanks, and great to be here, albeit remotely today. The research is incredibly interesting, and it does reflect lots of the things that we see day in, day out at GamCare. So GamCare are the largest provider of education support and treatment around gambling harms in the country, and we run the National Gambling Helpline, which operates now 24 hours a day, year round. So really interesting that the polling has said that that the 24-hour availability of gambling is a concern, because we shared that, and hence the helpline. We were fortunate to be able to extend that to 24-hour operation last year. And to give you a sense of the scale of our services, the helpline in the year 2019 to 20 dealt with about 38,000 calls, so it's quite a large volume. And of course, those callers are a broad church. Most of them are gamblers, but some are affected others, and a small proportion of professionals will phone for advice as well. In treatment, we work with a partner network around the country to deliver treatment face-to-face or now remotely, one-to-one and in groups, and we saw over 11,000 people in treatment last year. What we see on the helpline, which I think is really what mirrors your research quite closely, is that the three biggest impacts of people with gambling issues are financial, on mental health and well-being, and on relationships. And I think when we talk about the financial side, it's really important to recognise that that's not just about debt. It's also about people not being able to pay bills or not having money for other, usual things that they need it for. So that convergence of things made us particularly worried, actually, when we went into lockdown, because that combination of money worries, mental health concerns, relationship issues, and the isolation of lockdown made us very worried that that would exacerbate gambling problems, and particularly if people are furloughed and worried about money and had time on their hands, and gambling is quite accessible online, that was a real concern. In terms of what we've actually seen over the last few months, we've seen an initial drop in call volume when we locked down, because everybody was quite preoccupied with the crisis, and then subsequently we've seen a bounce back. So the week before last, which is the most recent data I've got, was our busiest week on the helpline in the year to date. So, really coming back to usual levels of activity. And of course, we've got more sport now available, and land-based settings are also open again. And I think it's useful to reference Gambling Commission data as well. They've been monitoring quite closely what's happening with gamblers through the recent period, and overall gambling has reduced, because obviously we've had no sport and the land-based settings have been closed. But engaged gamblers, so people who already gamble a lot, have been gambling more, and it's definitely been a risky period for people switching the type of gambling they do. So some people switching from sports betting to online casino, and also there's been an increase, I think, in sessions lasting over an hour. So several reasons for concern, and I know the Commission has issued guidance to operators to encourage them to increase their interactions with customers around safer gambling and the tools that are available. Some of the concerns that are coming through at the moment, particularly in the recent period, are the impacts of a convergence of gambling concerns and lockdown concerns on mental health and well-being. And our online chat rooms have been particularly busy with people talking about those concerns. And we've also seen an increase in domestic abuse as well, which is obviously sort of relevant to this, the mental health concerns, because the impacts are so significant of it. And that's not necessarily violence, it might be financial abuse or coercive and controlling behaviour as well. And we have also seen an increase in people presenting with real stress and anxiety about this convergence of issues that we've all been experiencing. So in terms of, for us, some of the priorities, I guess, in beginning to address this, one of the key issues is that gambling is just such a hidden problem, and people don't really talk about it. It's quite often seen as a male problem. We've been doing lots of work around women in gambling, which has produced very interesting results. But it's something that we need to be talking about more in our lives and with our families. So what does gambling look like for you, but also in professional settings? So if somebody's presenting with, money worries, are they asked about gambling? Do GPs ask about it? Do social workers ask about it? We've got lots of settings where we could start that conversation, and we need to raise awareness about referral pathways as well, and getting people into treatment. One of the things that we've done to help with that is try and make it as easy as possible, obviously, for people to come forward by putting in place warm transfers. So, for example, GamStop is the online self-exclusion scheme, and their callers can be transferred directly to our helpline. And we've also done that with some banks as well. So banks have a unique view of people's whole set of transactions, and can interact with vulnerable customers if they notice a high volume of gambling transactions. And I think what's really important is that people put in place both tools and support. So people need to use a combination of self-exclusion, software blocking, merchant code blocking, and seek support. So those tools will create some space in people's lives between them and gambling, but also have some support to get longer term solutions to gambling issues. There's lots of groups that we need to reach. As I say, not enough people come forward, and people with mental health problems are definitely one of those groups. They experience multiple difficulty in accessing services. There's lots of stigma, there's lots of fear, and there's a sort of intersection of a range of issues that make it quite difficult for people to come forward. So, we're under no illusions, there's lots of work to be done. But certainly research like this really helps us understand the issues that people are experiencing and get the right things in place to move things forward.
Thank you, Anna. That's fascinating, and particularly interesting to me to think about how we reach the group of people with gambling problems or experiencing gambling related harm who are also experiencing mental health problems. And absolutely, in Money Mental Health, we talk a lot about double stigma of living with both problem debt and a mental health problem. I think in some cases you throw a gambling problem in on top, and goodness, we have a lot of stigma to blast through, don't we? And to help people overcome that fear to reach out to services. Next, we're going to hear from Shahriar Coupal, who oversees the Advertising Standard Authority's regulatory policy, copy advice and compliance functions. As Director for the Committees of Advertising Practice, Shahriar is responsible for the effective running of committee business, which includes updating the UK advertising codes and associated guidance. Shahriar previously worked for Ofcom, so I'm sure he knows plenty about internet-based things from there as well. Shahriar, we'd love to hear particularly your thoughts on the report's findings in the context of the ASA's guidance for the gambling industry on vulnerable customers during the pandemic.
Sure. Thank you, and thank you for the invitation and the opportunity to speak on behalf of the Advertising Standards Authority. When I was working at Ofcom, I'm not sure that the internet was much of a thing. It was more TV and radio, but yes, I've learnt the ways of the internet via my current role. In my 5 minutes, I'm going to talk about our role and experience of regulating gambling ads, and in doing so, I'll try to engage with some of the insights that arise from the Safer Bet report from the Money and Mental Health Institute, which I think is a very balanced and good report and certainly very worthwhile. As the UK's advertising regulator, we set and police standards to ensure that ads don't mislead, harm, or seriously offend their audience. Our remit extends across all media, including websites and social media platforms. The Safer Bet report asserts commonly held perception that UK gambling regulation has not kept pace with innovation and growth in the industry. Our remit, which covers paid for and non-paid for ads online and across all digital platforms, certainly has. And I'll go on to explain how we've tried to keep pace in other aspects of our regulation too. Of course, it's the nature of regulation that we're always playing catch up to a certain extent. We tackle ads across all product sectors, but we're obviously not responsible for regulating the actual products themselves. So, for example, medicines are regulated by the MHRA, financial products fall under the FCA, and it's the Gambling Commission that regulates operators to safeguard people who gamble. These bodies entrust us to be the one-stop shop for advertising regulation, and they agree to act as our backstop powers in the event of any repeated or serious breaches of advertising regulations. We and the Gambling Commission work under the framework of the Gambling Act. As you may know, the Act removed advertising prohibitions and allowed for the first time gambling to be advertised on TV and gave greater advertising freedoms to other media. It did so in the knowledge recognised by the Safer Bet report that gambling is for many people an enjoyable recreational activity which can be enjoyed safely and responsibly. But it's clear that risk is inherent within gambling, and it's our job at the ASA to ensure that people who are vulnerable to gambling related harms are protected by restrictions on the scheduling, placement and creative content of gambling ads. We receive between 60 to 100 complaints per month about gambling ads, and they make up between 2 to 3% of our annual postbag of complaints. On a point of interest, those monthly figures haven't changed noticeably over the period of lockdown. Complaints rarely identify a breach of advertising rules, and they tend to be quite general in nature. People don't like them, there are too many of them, they shouldn't be seen by children, no matter that the ad is shown around content attracting a predominantly adult audience. It won't surprise you to know that we never get complaints that state an ad has directly led someone to chase their losses, bet more than they can afford, or do other things that are characteristically associated with problem gambling. But we know, of course, these behaviours occur, and that's why we set rules to lessen the possibility of ads condoning or encouraging problem gambling behaviours. For example, in line with insights from the Safer Bet report, ads must not suggest that gambling can be a solution to financial concerns, take priority over family and friends, or be a means to boost self-esteem or a way somehow to gain control. We also limit under 18s exposure to gambling ads by limiting them to predominantly adult audience. We accept, therefore, that within those audiences dominated by adults, children will see gambling ads, but where they do, our rules ensure that the creative content of those ads mustn't appeal particularly to children. We report annually on children's exposure to gambling ads on TV. Last year, children saw an average 2.5 ads for gambling each week, down from a peak of 4.4 in 2013. It's actually much more complicated to assess children's weekly exposure to ads across all properties online. So for the time being, we're using online scraping tools and child avatars to proactively identify gambling ads that are being delivered to child audiences in breach of our rules. That's perhaps another way in which our regulation has kept pace with innovation and growth of the industry. We're using technology to identify ads that we can't see, but children sometimes can. Through our consideration of complaints we receive and the monitoring that we undertake, we assess our compliance with our rules is high. That compliance rate owes in large part to the training and advice we deliver directly to gambling operators through webinars, e-learning, site visits and online guidance. And we also deliver a free pre-publication advice service for gambling operators' ads. Whilst our day-to-day work involves case-by-case assessments of ads, it's important for us not to lose sight of the bigger picture. And the Safer Bet report touches on some of these bigger picture measurements. The Gambling Commission reports that since 2011, children's participation in gambling, that means private bets, use of fruit machines and use of national lottery scratch cards, has actually halved from 23% to 11%. And the 2018 health survey shows fairly consistent rates of problem gambling, with 2.7% of people at low risk of gambling, 0.8% at moderate risk, and 0.5% classified as problem gamblers. So in a decade when we've seen an explosion in the number of online gambling services, significant increase in related marketing budgets, and the mass availability of internet-connected devices, which provide people with unprecedented access to gambling, child gambling participation rates have halved and problem gambling rates have remained fairly consistent. We're certainly not complacent, however, and we're committed to reviewing evidence which challenges our regulation to ensure that it remains proportionate to the evidence of harm arising from gambling ads. Findings from the Safer Bet report note that many of its adult respondents who have experienced mental health problems feel it was impossible to avoid seeing gambling ads, and some described the negative impact this had on their attempts to cut down on gambling. Whilst tools are available to limit exposure to ads, the report found that few of its respondents described having used them. Today, the ASA insists gambling operators use known and inferred data about an online audience to target their ads away from an under 18 audience. We're currently undertaking a project to assess the feasibility of offering the same protection for an adult audience who are likely to be vulnerable to gambling-related harms, and we're looking to conclude that work by the end of the year, and we will certainly share that work with the Money and Mental Health Institute. Finally, the report asks us and government to assess the role of advertising and marketing in driving harm and to respond accordingly. Over the last 10 years, we've conducted numerous such reviews, and we're currently assessing findings from the recent GambleAware research on the impact of gambling advertising. Our initial assessment of that research is that it does cause us to look again at whether we're getting the balance right between, on the one hand, protecting vulnerable groups, and on the other hand, allowing licensed gambling operators to advertise their services subject to strict rules on the scheduling, placement and content of their ads. We think that continues to be the appropriate balance to strike and in line with the public policy intentions established under the Act. Okay, I'll stop there and perhaps have a drink of water.
Thank you, Shahriar. That was fascinating, particularly to hear how effective the ASA's approach has been when it's come to reducing the extent to which children are exposed to gambling advertisements, and how that in turn seems to have reduced levels of gambling amongst children. I'm really intrigued to hear about the work you're doing about using similar technologies, encouraging firms to use similar technologies to reduce the way that vulnerable adults might be exposed to advertisements too. We'd love to hear more about that when you're finished. We're now going to have another go at Rachel's video. The tech may be in our favour or may not. I know the wizards have been trying their best behind the scenes, but we would love to hear that lived experience if we can. So over to the tech team. If you could all keep your fingers crossed, please.
So, Rachel, you've experienced both depression and gambling issues. Can you tell us a bit more about your experience of gambling online?
Yeah, well, it started with bingo and tombola online first. Then I started to win money, which felt amazing. So I started to think about online slots, bigger money, bigger payouts. It's definitely harder to manage online gambling because whenever you go online, something for slot is always advertising in front of you, like a special sign-up offer.
Thanks, Rachel. So, Rachel, can you tell us a bit about what impact gambling problems can have on your mental health?
Right. There's a couple, actually. Well, it makes me, when I'm winning, I feel on top of the world, as you do, because it's real cash. But when you're losing, it's not good at all. And every time I was getting stressed, that's when I was gambling. So it wasn't very good on my mental health at all.
Rachel. So how do you think your mental health has affected your ability to manage gambling online?
My mental health has made my ability to manage my gambling worse because I haven't long found out that my mood stabilizers go hand in hand with gambling. Every time I was feeling stressed or low, I would gamble, and that was every day.
Thanks, Rachel. That sounds really difficult. So some people tell us that they feel quite overwhelmed by gambling adverts when they go online. This can make it harder to stay in control of gambling. You mentioned this before, but is this something you've experienced?
Yeah, I've experienced, the gambling ads online do make it very hard to resist because mostly it's to do with the welcome offers they offer you to sign up that you feel you can't refuse.
Thanks, Rachel. So Rachel, in your experience, what kind of things have helped you to manage your gambling?
The only thing that has helped me to stop gambling is to self-exclude myself from the sites, which was really a nightmare to do. It took way too much of my time to find the right thing. I wanted which, lucky for me, I'm amazing with technology. Not everyone is, to be honest. Also, the gambling sites don't actually advertise the self-exclude area very well, which they should.
Thanks, that's really helpful. So more generally, what other changes would you like to see to help people to avoid online gambling problems?
Right, I think on the app sites also should invest in the self-excluding apps, not just the gambling sites, which is wrong. Also, gambling sites should set their own limits and not let you choose. That's just asking for trouble, to be honest. Banks have sorted out the credit cards, but what about the debit cards? I know on some banks you can stop it to use on gambling websites, but the banks should take responsibility and limit the amount people can use on a gambling website. They should definitely stop advertising on TV during breaks. Since the start of lockdown, the TV ads have been ridiculous. I've seen one more than 20 adverts a day, and that's absolutely horrifying. One last thing, they should definitely advertise GT and GamStop everywhere. They are self-excluding websites, apps, which are really helpful. Please check them out like I did.
Fantastic, thank you, Rachel.
I'm so pleased we got that to work. I know I find it particularly useful to hear Rachel's experiences there, the challenges that she had finding self-exclusion tools, and how useful she's found those tools when she did find them. Rachel, I hope you're watching today. Thank you so much for your contribution. We really appreciate it. And I think that puts us in a really good place to have a discussion, bearing in mind that we're talking about real people, not just abstract policy questions. So we've had loads of questions come in. Thank you so much for taking my request for early questions seriously. We do appreciate it. So we're going to start. We've had loads of questions to begin with about what more banks should be doing. So I'm going to group a couple together and we'll let the panel have a go at them sort of collectively as they're on similar themes. The first one is from Jamie Evans of the Personal Finance Research Centre in Bristol. Hi, Jamie. Can more be done to help build partnerships between treatment providers and banks to help people stop or control gambling? And Jamie has a particular question about whether active referrals would be better than signposting in that space. We've also had an interesting question from Natalie Ledward of Monzo. Hi, Natalie. What can banks do to help? Should we be looking at wider spending controls or more on improving support with signposting and referrals? Anna, do you perhaps want to have first go at those from what you see in the people you work with at GamCare?
Yeah, sure. So at GamCare, we've actually got a piece of project work specifically around gambling-related financial harm, and that brings together people with lived experience, debt agencies, banks, gambling operators and treatment organisations to look at what can be done. And there's a number of practical things that could happen. So we do now have 8 banks and financial organisations that offer merchant code blocking. And that's really important so that people can turn off gambling transactions. But that works best when there's friction in terms of turning them back on. So if you can turn it on and off, it's not very useful. If you have to wait 48 hours to get it unblocked, that's the best way forward. And I noticed one of the questions was from Monzo, and they're one of the banks that were one of the first actually to have those merchant code blocking facilities in place. The other thing that we're doing is working with banks' vulnerable customer teams to provide training to them around how to spot gambling harms and how to interact with those customers. And we've got a single question screening tool that people can ask. And then we've also put in place warm transfers with some of the banks, so they can transfer that person on the phone directly into our helpline, and our helpline will provide them with support and link them to their local treatment services. So we can very seamlessly get people into the support that they need. And we've also got a relationship with RBS and NatWest, such that they offer us rooms in their banks in which to deliver our treatment interventions. So for the person coming in, it's great because it's a really discreet location, it's on a high street, it's easy to find, and it means that we can work closely with the banks and really raise awareness of the issue, but in a very discreet way. So there's quite a lot of work going on, and the thing I would say about banks is that they have the total view of people's gambling transactions. So gambling operators can only see what somebody is depositing with them or winning or losing with them. But the most problematic gamblers have numerous accounts usually, and banks do have the view of that. So they've got quite a critical role to play in helping to identify and intervene with people experiencing gambling harms.
Merlyn, any reflections from you?
Yeah, I think I agree with what Anna said there, really. I think we've seen lots of positive steps in recent years from banks and other financial service providers to provide people with tools to help manage their gambling. And some respondents to our search community survey were very welcoming and supportive of them. People also felt that because of that unified view that banks can have, they could perhaps play a role in spotting problems earlier and helping people get support. As I mentioned in the research, people with mental health problems can sometimes struggle to act quickly and seek help when a problem is developing. So it could be really, really powerful if somebody else were to spot a problem early and to let them know. So in terms of things that people from our research community thought would be helpful from banks, one of them was setting safe limits on gambling spending as a default. So in the same way as there are limits to how much you can withdraw from an ATM each day, this could be a really powerful way of limiting the amount that somebody can spend on gambling. Most customers wouldn't be affected, but it could make a real difference to those who have more severe gambling problems. We also found generally that people would like their banks to play a more proactive role. So when there are signs that there might be a gambling problem developing, for instance, suddenly spending much larger sums on gambling or spending large sums on gambling during the middle of the night, people would like their bank to be proactive and offer support. I think people saw the value in signposting, but really what would be more welcome would be practical support. So if the bank has something like a spending block or has a referral pathway to a service that can directly help somebody, that would be more welcome, really.
Brilliant. Thank you, Merlyn. And an interesting one now for Shahriar from Simon McNair of the Behavioural Insights team. Have the ASA reviewed how popular video games promote things like loot boxes and so-called surprise mechanics that evidently mirror actual gambling mechanics? Shahriar, is that something that you've come across in your work at the ASA yet? Is it something you're worried about?
Yes. Loot boxes are a cause for concern, not just for us, but also for the Gambling Commission and for government as well. Indeed, when government is setting out to review the Gambling Act, it's doing it with a view to understanding whether the Act is relevant given the explosion of gambling services that we have online, and with particular regard to issues like loot boxes. Loot boxes at the moment, as I understand it, are not considered as gambling products. Although confusingly, some European jurisdictions, as I understand it, do consider it as gambling products. In between the licensing of these as gambling products and mechanics that clearly attract an under 18 audience, we think it's important for the ASA to consider what role we have in ensuring that under 18s are protected from marketing of these loot boxes. So we are currently looking at loot boxes in the round, talking with stakeholders like the Gambling Commission and Ofcom to understand whether our general protections that afford protections to under 18s in particular is something that can be applied to loot boxes whilst government continue to consider the regulatory status of them. So it is a live issue. I'm afraid it's not one that we have a definitive answer to at this point, but it is one that is we are currently wrestling and will have an output on by the end of this year.
That's fantastic to hear. Merlyn, I'm intrigued. I know we hear a lot to talk about loot boxes in the context of particularly protecting children from gambling. Is it something that worries you from a mental health perspective as well?
Yeah, so I think we heard a bit about this in our research. I think, as was mentioned, I think some of these kinds of services that technically sit outside of the current remit of gambling regulation but act in similar ways. Some of our research community respondents did suggest to us that if it's working in a similar way, it's likely that similar sorts of harm might arise, and because of that, it might be fair to have similar sorts of consumer protections. And I really hope that the review of the Gambling Act will look at these types of activity that are currently outside the remit and consider what harms get going there.
And Anna, loot boxes, are these something that are coming up as problematic amongst people that you work with at GamCare?
So we have a youth education programme at GamCare, and it's certainly an issue that is talked about in the classroom. And actually, it's not just loot boxes. They are an important issue for us to consider, but there's also accompanying things like esports, gambling-like behaviours in games, skins betting, and they're all definitely concerns for young people and for adults working with young people. So as we're hearing, we don't quite know what the Gambling Act will bring, but it's certainly an issue that needs to be addressed and that isn't going away. And from our perspective, we really need to be focusing on ensuring that young people understand the mechanics of what's going on there and are able to make informed choices about engaging in those products. And it's actually really important that parents understand as well, because a lot of parents don't fully understand what skins betting is, for example, or the extent perhaps of esports or loot boxes. So there's a big piece of work to do around that.
Fascinating. Thank you, Anna. I think loot boxes for me are a really interesting example of how these technologies are changing so quickly, and we're really having to race to work out how we regulate them and what we need to be thinking about. Another interesting question on advertising here, which I don't know who would like to have a go, but I'll throw it out anyway. Someone anonymous, and particularly thinking about social media. So is it possible to force, particularly Facebook and Twitter, to have a simple option to permanently turn off gambling ads for a user, given that current options are time limited? Anna, I guess I'd be interested to hear how social media advertising is that something you hear about from people with lived experience? And Shahriar, what are the specific challenges of regulating advertising on social media?
Do you want me to go first?
Yes, please. That'd be great.
I mean, yes, obviously social media advertising is a concern, particularly around young people, actually, because a significant minority of young people are exposed to it at below the age of 18, so when they're not old enough to actually gamble, and they do sometimes engage in that content. And certainly what our service users say is how difficult advertising can make it in recovery. So, for example, it might be difficult for them to enjoy sports because there's so many triggers around gambling in that, in terms of advertising and shirt sponsorship and so on. So that's a real concern from their perspective. My understanding is that if you sign up to GamStop, the self-exclusion scheme, that most of the direct marketing should be blocked, but it is difficult, particularly on social media, to control some of that indirect marketing. And I think internet service providers and social media companies definitely could be part of the picture. We've got self-exclusion and we've got software blocking, we've got merchant code blocking, but there is also scope for internet service providers, also actually mobile phone companies, because you can run up serious bills on your mobile phone gambling. So there are other players that could come into this space and just add to the tools and protections available for people.
Thank you, Anna. That's a really interesting reflection, isn't it, on how many different players we need to be involved in helping protect people in all the different places we can offer tools. Shahriar, I'd really like to hear the challenges particularly you might face around social media regulation.
Yeah. But I think one of the pieces of evidence that the report highlights is that there are tools available for self-exclusion, but for whatever reasons, they're not often used. And so I just want to elaborate a little bit more on the work that we're doing to try to ensure that advertising for products to which adults might be vulnerable are targeted away from those audience segments. We have guidance around alcohol and gambling marketing that says that when you're choosing interest space to target your ads, you need to choose interests that are likely to attract a predominantly adult audience. So here we're looking at things like an interest in home buying, for example, that might take gambling or alcohol away from a child audience. As I say, we're currently looking at a vulnerability matrix in relation to problem gambling and seeing what interests that the platforms provide that might inadvertently target those vulnerabilities. So that's a piece of work that I think will hopefully add to the protections that are currently afforded to people who want to reduce or stop gambling together by self-excluding. Some of the challenges we have, of course, in this space is that we're dealing with people's own accounts, and it's difficult as a regulator to look into people's accounts to see exactly what they're receiving. But we are currently working with the 7 social media platforms that are most popular with children in the UK to invite them to share data with us that gives us a good idea about whether alcohol advertisers in the first instance are moving their ads away from children's audience. And we'll gravitate that we intend to move on at that point to look at other products like gambling as well, to ensure that gambling operators are making the right choices in terms of their targeting. This is kind of embryonic regulation at this stage. You know, as I say, the Safer Better report makes it clear that we need to keep pace with online technologies. We're in the foothills of it, and we hope to develop it as the years come. But there are challenges, not least because these platforms tend to operate in kind of silos. And whilst we have been successful in bringing these operators together to tackle scam ads that you see across social media, we think we need to now move it on a little bit more to deal with other aspects of our regulation, perhaps indeed including gambling and other such advertising as well.
Fascinating, thank you. Another question, another anonymous one. This time I think Merlyn, you might like to have a go at this. So there is a complexity in banks identifying what's problem gambling as opposed to recreational gambling, and particularly and what's customer choice and when they should intervene. How should we differentiate between those two things?
Yeah, I think it's a really fair question, and I think to some extent perhaps it's not as useful for banks to be trying to work out what is problem gambling, what isn't, but rather for looking at likely signs that somebody might be experiencing a problem and then offering support. I think in this piece of research, and also in some previous research with our research community, we've looked at some of the sorts of financial triggers that people would like to be alerted of if their bank spotted it. So I think it's a good place to start, right? What do people actually want? Then I think the other side of it is getting the intervention right, getting the tone of the message right. I think if you go in and you let somebody know, oh, we think you're a problem gambler, this is a problem, what you're doing is problematic, maybe that's less likely to land well. But instead, if you say that we've noticed something in your account and these are some support options, that's perhaps a more neutral way to frame it in a way that might be received more positively. Generally, with all of these sorts of things, we'd always recommend that when you're designing the messaging, you're working with people who've experienced the problems to find out what the best way of phrasing things would be.
Anna, is there anything you'd like to add to that?
Yeah, I mean, affordability is a really complex issue for both for banks and for gambling operators as well. But I suppose the main thing I'd add is that obviously money spent is a significant indicator, but there are other things as well, such as the length of session, maybe the time of day that people are playing, time spent overall, over the week, how much time appears to be spent on gambling transactions. And banks and gambling operators do have visibility of some of that wider context, not all of it. Obviously, a bank won't know what's going on in someone's personal circumstances, but I think it is about affordability as well as those other issues like preoccupation and time spent.
That's really helpful. Thank you to know the breadth of knowledge that banks have and the different indicators they might draw on. We're coming towards the end of our time, so perhaps just to bring us back to the current COVID context and just to reflect a little bit on how all firms are doing and how far we might have to go. Shahriar, I wondered if perhaps we could finish with your reflections. So we know that in April, the ASA publicly reminded the gambling industry about its responsibilities to vulnerable customers under the UK advertising codes. How would you say the gambling sector responded to that? And what more would you like to see in this space going forwards?
Well, it's quite clear that it's not only the ASA, but it's other organisations, the Gambling Commission and other parties who have put the spotlight on the gambling industry during this time of unprecedented change, especially concerns around finance and people's careers as well that might lead people to gamble more or to begin with. We haven't seen evidence through complaints that gambling operators are exploiting the situation by appeals to concerns around financial problems. We'd be very concerned if we did see that. But we have obviously seen the pressure, perhaps not just from us, but from other parties as well, that has led many gambling operators to stop gambling at the moment on TV and radio for a period of time. I think the Safer Bet report asks for that moratorium to be extended to at least until social distancing measures have been finalised, and that's obviously one for the industry to respond to. And as you'll know, the industry has always taken measures to go above and beyond the mandatory rules that we set for calculations that it's a better place to answer than me. But no, we haven't seen gambling operators exploiting the situation. We have seen some evidence from our online monitoring technology that indicates we're seeing a handful of operators still being not as circumspect as they could be in terms of their placement of ads online. We're seeing too many creeping into audience segments that comprise a significant number of under 18s, which we're concerned about. But we haven't seen a peak, I have to say, that suggests that there is a systemic problem going on in terms of taking advantage of the current context.
That is reassuring to know, Shahriar. Thank you. It sounds like there's work still to do, but good, you know, genuine willingness, I think, across the regulators and, of course, the wide range of voluntary sector organisations working in this space, like GamCare, our friends at the Behavioural Insights team, and PFRC down in Bristol too, all working together to try to drive improvements to this space, to make sure that people across the UK can enjoy gambling and that adults who are at risk aren't put at further risk of gambling-related harm as well. That's about all we have time for today. It just remains for me to really thank our guests. Thank you, Shahriar Coupal from the Advertising Standards Agency and Anna Hemmings of GamCare for joining us today and sharing your views so generously. We really appreciate it. Special thanks to Rachel as well for agreeing to share her thoughts with us by video, and to Merlyn and Chris for the fantastic research. This is just the first in a series of papers from Money and Mental Health, exploring the interactions between online harm, some of the risks we all face on the internet, and particularly how those interact with mental health problems. Is the internet a safe place for people experiencing mental health problems, or is there more we can do to keep people safe online? We'll have more papers coming in this space through the rest of this year. Of course, all the more relevant while we're all stuck at home. And so I do hope you'll continue to engage with our work. Please check out our website, www.moneyandmentalhealth.org, where you can find the research and all our other work. Thank you very much for joining us today, and I hope to see you at another Money and Mental Health webinar very soon. Goodbye.